Hello, students. A very happy new year to all of you. May this year be the best year of your life. And I'm sure that whatever exams or the phase of life you are in, you excel in that phase. Now, today's video is going to be about NEET PG preparation during internship. A lot of students ask me that I have a very hectic internship. I get, I have to work for 12 to 14 hours in an internship. Some postings are very heavy, some postings are very light. How to prepare for a PG entrance in internship, especially they ask from me because I got good ranks during my internship attempt as well. So this video is gonna be about your NEET PG strategy if you're an intern, or for that matter, any hectic job if you're working. Let's say some post interns are doing a job while preparing for a NEET PG, how they should go about it. Right? Now, first questions first. Should you prepare during your internship attempt? Now the answer is a resounding yes. You should definitely prepare for an internship attempt. At least read or prepare some part of your preparation. Okay, let's say you do. I'm not saying that you read completely A to Z if you have a hectic internship. I know a lot of places do have a hectic internship, and unfortunately you don't have that choice to bunk the internship. Not that I recommend that you should do that, right? But even if you have a hectic internship, try to read some part of it. What to read, how to balance everything, we'll talk in detail in this video. Now, why you should read at least some part? Because when you will actually start preparing for your PG entrance next year, you won't be at zero. आपने कुछ पढ़ रखा होगा. You would have some confidence that okay, I had this lack during my internship. I could not read, but I am starting at, let's say, 30 or 40. I'm not starting at zero. And that is a very, very big difference in the mental peace, in your satisfaction, and in your morale in general. So I'll say you'll save 1 year. You will save 1 year. अगर आप internship के बाद पहली बार attempt करोगे, then that attempt becomes your most important attempt. That becomes your first attempt, in fact. But if you have already given an attempt during internship, then you know कि what mistakes you have done. You are at a slightly lesser pressure कि कोई बात नहीं, मुझे पता है क्या गलतियां की हैं मैंने. I need to just improve. If you don't study at all during internship, the next year becomes very, very hectic, very, very mentally taxing as well. कि आपको लगता है कि okay, I have to give it 100% because this is the year that I have to make it. So you are less stressed in your next attempt if you prepare, if you read something during your internship. Now, busy internship hai, how to study? Most important question. Now, any place, in fact, majority of places will have some postings during their internship which are hectic. Some are very hectic. So some maybe have 12 to 14 hours of duties per day. And so, in those very hectic duties, you cannot read. Simple fact है कि यार इतना काम अगर होता है तो दिमाग नहीं चलता है. You are not in that mental capacity to go back home again, sit in front of the book or watch a video. You just want to lie in the bed, have a good night's sleep, maybe scroll some reels, relax yourself. Okay, toxicity भी इतनी हो जाती है internship में, hectic postings में. So you just survive. The main aim in a hectic posting is to just survive, take care of your health, eat all 3 meals if you can, and make, I mean, just agree to the fact that this is not your battle. This 3 4 months, whatever hectic postings you are in, this is not your time to shine. Take important pictures. जब भी, let's say, you are in a posting, you are reading ABG, taking out samples, just look at the ABG. What is the interpretation, how you will analyze this? Okay, you're taking sampling, just have a look at the vacutainers that you are taking samples in. जब pathology report you are collecting, just have a look at the findings. Okay, you these things get in your subconscious mind, and थोड़े टाइम बाद आपको लगता है कि okay, ये चीज़ यहाँ पर देखी थी, and it strikes in the exam room, and you don't even know that you got the answer correct. So a very hectic internship, the main aim is to survive. Now, what are the hectic internship postings? So let's say postings with 8 to 10 hours of work. So let's say you go 8 in the morning, come back at 4 or maybe 6 in the evening. So you have around 3 4 hours of self study after your work. Now, in these hectic postings, these are again hectic postings. You only have 3 4 hours of study, after maybe sleeping for an hour or two or whatever. So in these hectic postings, don't try to read a major subject. Pick up a minor subject. Anesthesia, ortho, derma, psyche, ENT, ophtha. What it will do, it will give you a sense of completion. It will give you a sense of completion. Ki, okay, In these 30 days, at least I've covered two minors. अगर आप ऑब्स गाइनी मेडिसिन जैसे सर्जरी सब्जेक्ट उठा लोगे, then you won't be able to cover that subject and it will keep on bothering you. बहुत ज़्यादा प्रेशर आ जाता है दिमाग में. You won't be able to study at all. So in a hectic posting, choose a lighter subject, minors. Or pediatrics, again a lighter subject. Physiology, again a lighter subject. Now it is light postings. It is light postings in which you have 8 to 6 to 8 hours of work maybe. So you go 8 in the morning, maybe come at 3 or 4 at in the evening. So you have around 6-7 hours of self study after your work. Now these are the postings in which you have to make the most of it. Now how to go about in the light posting? So take major subjects. So in a light posting, which brings us to point number 3, how to study. So you take major subjects like obs gynae, surgery medicine, path pharma micro, or biochem anatomy. Now, depending upon how many light postings you get in your internship, it varies from college to college. So you might get 2 months, 3 months, 6 months. It doesn't. I don't know. You are the best judge. So depending on how many months of light postings you get, you divide the number of subjects. It is not important to cover everything. Whatever you can, you do. That's the only thing that I'll say. Now, in these light postings, in these major subjects, what to read, where to read. So first, make a list of what are your weak subjects and what are your strong subjects. Now, if your weak subjects are anyone amongst these, except medicine, so you should try to read them from your main notes. Because a weak subjects coming from these 9 subjects will have a very big impact in your final score. So unko you need to have good concepts, and that's why I say you read them from the main notes. For strong subjects, you only know आपके कौन से strong subjects हैं. Your RR notes plus PYQs plus FWTs will suffice. FWTs are subject wise test. Now again, in certain topics, let's say that CA ovary is a very hot topic nowadays in I9CT, or breast is very hot topic, hepatobiliary, general surgery, very very hot topic in surgery. So unki you can also do topic related Q bank. So for example, you are reading ABG and you're having problem in understanding ABG in medicine. So you solve that question, that topic ka Q bank, right? Now, how to do test and discussion? Should you do test and discussion? Now, I'll highly recommend all of you should join a test and discussion. In my opinion, it is a must for interns and post interns, right? Now, what does a test and discussion do? It basically gives you a schedule. It gives you a schedule which you can follow, and that is the biggest advantage of a test and discussion. आपके ऊपर से वो बोझ हट जाता है schedule बनाने का. In a hectic posting, how to attempt a test and discussion? You don't have the time to read for a test. So just attempt the test and discussion and just note down कि test में and discussion में topics क्या cover हुए थे, which were the PYTs which were covered in the discussion. Just make a list of the topics so that you can maybe read them when you get a light posting, or maybe next year when you're finally preparing seriously for that NEET PG attempt. In a light posting, this is again the time when you shine. Make the most of it. Prepare for a test, give the test diligently, attempt a test and discussion, and note down the important points. Now, if you want a separate test and discussion, we have a TND batch also of MEDED by the name of Sankalp NEET PG batch, right? In which we'll be covering the test and discussion. It is starting from 15th January. So the first test is of pathology, and we'll cover everything in April by April 20th. Right? So if you want to join that test and discussion, again, you are most welcome. Very nominal fee, 3,500. But I'll highly suggest any test and discussion you should join. It gives you, a schedule which you can follow. Now, what are the broad timelines for all of you if you are in an internship? Now, depending upon when your internship starts, so at AIMS it starts in January, ends in December. So broad idea is that first 7 months should be dedicated to your first reading along with your test and discussion. Okay, so depending upon how many tests you are able to give, if you are self-studying, that is also fine. So first 7 months, first reading. Then the next 2 months, first revision. Next 1 month, R2, that is second revision. And the last 10 days are your final third revision, last 10-day revision before the exam, which I have made a separate video of. Now, 1 month before the exam, what you should do? If you are revising your strong subject, for example, my anatomy was strong, surgery was strong. So I revised them while solving question bank. So that is a retrograde revision method. You do question and then read the explanation or go back to your main notes. For weak subject, read your annotated RR notes, then solve subject-wise test and PYQs. All right. Now, 1 week before the exam, like this is the time when you have to give in 100% of your effort, of your time. So I'll highly recommend that if you are in a hectic internship, please take a leave. Okay, extend हो जाती है internship. बाद में you can cover internship after your exam. It's totally fine. And for most entrance exams, the eligibility for internship cutoff date is 1 or 2 months after your exam date, so that can also get adjusted. But last 1 week before the exam, if you can, preferably take a leave. And lastly, I would say that please don't make this exam bigger than your life. In fact, like most things in life, don't take this exams too seriously. NEET PG or INICT concerned, ठीक है. Mental peace, I know, gets hampered during preparation. थोड़ा little bit is fine, but don't be so anxious that it engulfs you. Okay, like anything in life, don't take it too seriously. So that's all from my side. Thank you, and I'll see you in the next video.